Addiction is a chronic disease that is characterized by drug seeking and abuse that is difficult to control, even with harmful consequences. Drug abuse is one of the most pressing social health concerns in modern-day society that affects individuals, families, and entire communities.
President Nixon had the war on drugs started in 1971. Over that time period to current, we've spent over $2 trillion on the war on drugs.
We've already seized 13,000 pounds of fentanyl this year. That's enough fentanyl, as was mentioned earlier, to give every member of the United States population a potentially lethal dose.
Between 2010 and 2021, approximately 734,000 people lost their lives due to overdose, with the number of fatalities not only steadily increasing, but surging dramatically in recent years. In 2021 alone, just above 100,000 people have died due to substance misuse.
While addiction can impact people from all different social classes, its consequences are often magnified in underprivileged communities. Several factors ranging from race to social status, even to education, can impact one's likelihood of developing a substance abuse disorder.
These communities are actually communities that have been exploited and divested historically.
Some of the factors I think that can make a difference are when people have multiple stressors. So for instance, in lower income communities, if they have fewer resources, more financial stress, all of those kinds of things, plus maybe exposure to trauma.
They don't have the same opportunities available to them as the opportunities available in wealthier communities.
For example, there's more tobacco and liquor stores and more density of availability for those things in low-income areas or in neighborhoods where there's more Black and brown residents. And that's not an accident.
Once addicted, some people are willing to do almost anything to keep their addiction going.
But dope sick is a word that I heard over and over from users, and it is the word they use to describe the very painful withdrawal when they can't get the opioids that they are now addicted to.
Some people might join drug dealing in order to support their habits, and they sell drugs in order to be able to use drugs. So people are going to survive and do what they got to do. And people in these communities talk about needing their medicine because oftentimes these drugs, when they go into withdrawal, they get very sick. And the only way not to be sick is to use the drugs.
Because at the end of your journey, you're not doing drugs to get high, you're just doing it not to be dope sick.
Several factors can prevent individuals from seeking help for substance abuse after becoming addicted. Certain barriers exist within all social classes.
What I think is really important as a barrier is stigma. And this exists across all levels of the kind of socioeconomic or financial spectrum.
A survey was conducted on individuals who refused to receive professional mental health services. Majority of the people who avoided help was mainly due to financial reasons, such as cost and health insurance, making up to almost 65% of the people surveyed. 77% of the people also agreed that limited access and an awareness of where to go, concerns about committing to medicine and managing without treatment, and insufficient insurance coverage also caused a barrier between them and their needs for physical and mental health.
I think the idea of, a high-priced addiction treatment center where maybe more in residence and have more resources or things like that might feel less accessible to a lot of people.
We know that stable housing and meaningful employment have a big impact in addiction.
COVID had a large impact on drug-using individuals. 13% of Americans increased or started substance abuse during COVID-19. Furthermore, in June 2020, 73 million hospital records were analyzed. Substance users made up 10% of those hospitalized, but 16% of diagnosed COVID cases.
Mortality rates from COVID-19 were much higher for people of color and people in marginalized communities. And so obviously that kind of traumatic loss, when people have gone through something or they're really struggling with the loss of a friend or family member, we know that that kind of trauma can drive substance use.
Furthermore, it's important to take into account that certain underprivileged communities have a much higher police presence compared to wealthier and privileged communities, which often leads to over-policing and discrimination, as residents of the over-policed areas are more likely to be targeted for minor drug offenses compared to individuals in wealthier neighborhoods. Statistics show that Black and Hispanic individuals, despite similar rates of drug use compared to white counterparts, are arrested and incarcerated at significantly higher rates for drug-related offenses.
For too long, Neighborhoods, police, and the communities that they serve have separated. They don't feel a great connection.
Although the people in underprivileged communities face several barriers when it comes to accessing treatment, there are ways for them to receive help.
Sometimes having more community-driven treatment programs, especially with peer supports. So kind of helping to match people with people with lived experience who are in recovery, who have kind of been through it, who are also familiar with a lot of the things that they might be dealing with day to day.
And there's a whole other set of services, especially for people in these communities that don't have resources, people who are homeless. Offering them employment opportunities is absolutely critical. Training, giving them skills that they can use to obtain meaningful employment and better themselves over time.
There is hope for these communities to get better. Effective treatments that are tailored for individuals in these communities need to be implemented so that everyone can have a fair chance to a better quality of life.